Hi, and welcome to the Soul and Survival podcast with Grant and Louise Bentley. We have run the Victorian College of Classical Homeopathy since 1995. We are both qualified practicing homeopaths, and Grant is also a naturopath. Together, we discovered a link between energy and facial structure based on traditional ideas from homeopathy that have roots going back 200 years. This project is called Homeopathic Facial Analysis, or HFA for short, and has been the cornerstone of clinical diagnosis and training courses since 1999. Between us, we have written and produced 7 HFA books, including Soul and Survival. Soul and Survival is the philosophy of energy influencing matter and how this energy forms individual facial structure, our unconscious drives and fears, our life patterns, and universal time cycles.
Hi again, everybody. Welcome to the Soul and Survival podcast. I'm Grant Bentley, and welcome also to my wife, Louise.
Thank you, Grant.
Before we even begin, I think I remember last time we were talking about, I can't remember the overall topic, but I remember saying that sperm lives in the male body for 21 days. I knew that was wrong. Even as I said it, I knew that was wrong. That's why you looked at me and said, "Are you sure?" Because of that quizzical look that I had on my face. But it's 75 is the answer. But I knew that. I knew that straight away. I don't know why I said that. So there you go. So I thought I'd better do a clarification.
Does it make any difference to your thoughts on the overall topic?
Not a skerrick.
Okay.
But you want to be right, though, right? I mean, that's the thing. You want if you're going to be quoting numbers, then you want the numbers to be right. Okay, so
right.
You've got a pen and some paper.
I do.
What's on it?
All right, so look, this might be perhaps not as deep philosophically, but we just did the HomeoSummit, I think, it was a couple of weeks ago now, in the US, and they had a lot of homeopaths on there, including yourself and myself, and we got some really nice feedback, which is great. I'm sure by the time this podcast comes out, because we are a bit ahead of ourselves, it'll be a little further past, but that doesn't matter. Few people made comments about wanting to know more about the process, and I guess when we do these talks, we focus more on the philosophy, the thinking behind it, the research behind it, the ideas, and it can be hard for someone who's new to even get their head around what that might mean in real terms. So I'm just going to ask a few questions, and I know it's pretty simple for you, a bit ABC, but just maybe for people that are kind of interested but would like to hear a little more ABC. So, and the ABC topic is clinical focus. So I just wanted to ask you, because you do a lot of clinic, you do a lot of patients every week, what do you think's most important about the whole HFA process that leads to really great remedy outcomes and case outcomes? Meaning
what exactly? I'm not 100%.
Well, I mean, if we break the process into the steps, okay, for example, there's the photos, there's the way you look at the case, there's the repping, there's what you do with the first remedy, and then there's the case management. So there's 5 different areas. Let's start with the photos. What do you think? What do you think is really important about that process? Using the photos, the face.
Well, every aspect of what you just said, every point when taken in its individual point, is really important, because so it's a package. It's like there was a question one time from a patient of mine that said, maybe also if we could tackle the question of what is the difference between HFA and classical homeopathy, and the answer is, well, I regard HFA as being classical homeopathy, but I did think that a lot of classical homeopathy is incomplete without HFA, if that makes sense. So yes, HFA is classical in the sense that when When you talk about classical, I think what we're saying or what we're trying to refer to is it as Hahnemannian as possible? Now, you've got to also remember that Hahnemann wasn't a Hahnemannian, right? Because he was constantly changing. The next one that we often class as the most Hahnemannian homeopath, which would be Kent, was nowhere close to being a Hahnemannian, not when you look at how they both practiced. So when you're talking about classical homeopathy being the attempt to find a constitutional, then you're looking at HFA is the process where, well, look, let's start with Hahnemann himself. Now, Hahnemann was saying in order to go for a constitutional remedy, as opposed to an acute. Now, an acute is just like giving, trauma or Antart for chicken pox or arnica for a fall. But what you're doing with classical homeopathy is that you're trying to come up with a remedy that is going to energetically boost the constitution of a person. It's a tonic, right? And in some ways, the idea of a constitution, or constitutional, which has died out completely in conventional medicine, is a really important factor in all alternative therapies, because the one thing that unites all alternative therapies is that the healthier you are, the better you're able to deal with illness and stress generally. Excuse me. So in dealing with the constitutional, you're trying to boost up that person in reference to their health, their vitality, their happiness, and the flow-on effect of that better immune system, that better healing, that better rebalancing process. Now, that's what we call classical. It's constitutional prescribing. Classical prescribing or constitutional prescribing, as Hahnemann laid out, was that you have the first thing that you're trying to do is that you're trying to you've got to include the miasm. That's number one. He said that the miasm of the patient's got to match the miasm of the remedy. Without doing that, then you're not even close to it. Now, as best as I understand, unless something has been invented in the last 6 months that I don't know about, that is able to objectively, which is really important to point out, if there is a method that has just been developed that can objectively match the miasm of the patient to the miasm of the remedy, because up to my knowledge, HFA is the only one that can do it objectively. Everything else is subjective. Do you know of anything that's objective?
I don't think so. I think that's really important, the objectivity of it all. And in relation to the photos specifically, the facial photos, these are a set of photos. For those who don't know, we ask for 9 photos, front on, profiles taken at a very specific angle. It's quite important, 90 degrees. Smile, the teeth, some expressions to show lines. And all that information from those 9 photos, when we do a really good analysis, we're presented with the right photos in the first place, means we have a strong likelihood of choosing which dominant miasm that patient has. And then when you're choosing the remedy, the two are going to match. So the photos are just absolutely crucial as the starting point.
And it sounds like I went off on a completely 90-degree angle in accordance to the question that you asked, but I didn't. And that's exactly where I was going to go myself, is that once you've just got to establish what it is that you're trying to do, right? So what you're trying to achieve is you're trying to achieve a constitutional prescription. And the constitutional prescription, by definition, is a remedy that is going to deal with more than one or two problems all at the same time and boost a person's energy. So, for example, if you're taking a course of antibiotics or you're taking even an acute homeopathic remedy, you can get rid of a cold a little bit more quickly, or you can get rid of the chickenpox a little more quickly, but then you've still got that recuperation period. Now, that recuperation period is much, much shorter if you're taking a constitutional remedy. And so that's kind of what I mean. It's not the eradication of an illness or just the ameliorative palliation of a trauma, which are all important. But what a constitutional does is that it makes you that sort of, that it's hard to define what you is exactly, but that you, in yourself, your spirits, your energy levels, that is what all feels better. And the better that you can be, the better that you can deal with stress. Now, the number one thing, which is why I went off on that tangent, when you go to Hahnemann, is when you're trying to come up with a constitutional remedy, the first thing that you have to do is match that miasm of the patient to the miasm of the remedy. But how do you do that without guessing, which is all subjectivity is? How do you get that objectively? Now, that's where the photos come in, because that's what HFA is. In fact, HFA cannot be more Hahnemannian if it tried. I mean, people will say, oh, that's a ridiculous idea, but this is just because they don't know it.
Once you know it and you understand it, you're locked in. You really get it. And we hear this from students all the time. It's not like an instant magical answer. I think some people have that idea that somehow you just quickly find a remedy and that's it. It's a process, and the process of finding the miasm is via the photos. And what the photos show is the structure of the face. We look at the hairline, the forehead, the eyes, the nose, the ears, the mouth, the teeth, the chin, the lines on the face. All of that is analysed and allocated to one of the three primary miasms.
And it's not about appearance. We need to sort of stress this. I think sometimes people just think that, oh, well, they're just doing something, they need to know what we look like. No, it's not like that at all. Like, as you would know, that when we look at these pictures, we're doing measurements, we're doing comparative sizes, we're doing shapes and the whole thing. That's what it's all about. And the reason that we came up with it in the first place is because there were numerous writings by authors that had donated their whole lives to the development of constitutional prescribing that were trying to, well, they had seen that connection. They had spoken about the syphilitic patient, the psychotic patient, the psoric patient, and not only in a manner that describes signs and symptoms, but starting to then move into countenance and then move into actual structure. And so, I don't know how many years ago it was now, I remember thinking, I was reading...
I can tell you.
How long?
25 years ago. I'm pretty sure it was about maybe 26, 1998, 1999 it was.
Was it?
Yeah.
Okay. It feels a long time ago sometimes.
Well, it kind of is, quarter of a century.
So, yeah, well, that's...
It is a long time ago, let's face it.
Yeah, no, well, we're both in our 60s now, so, I mean, it feels like yesterday when we just sort of started on this journey, but in fact it was a quarter of a century ago. Like I said the other day, I thought getting older would take a lot more time than what it actually has.
It's gone very quickly.
It's gone very quickly.
Yeah.
But so in the end, and we knew that some of these miasms, like if you take that syphilitic miasm, for example, there were countless examples in both homeopathy as well as in conventional medicine where you could see the flow-on effects of that particular disease in the facial structure of the generations that would come from it. Like the wider set eyes, the bulgier forehead, all these sort of things. They knew about this. So I had a starting point.
That's 100 years old now.
Yeah.
That syphilology book that you kind of worked with for a while.
And so now what it was, to cut a long story, and it was a very long story, but we just went through the very methodical process of working out what every eye shape, what every forehead shape, what every nose shape, what every bridge of the nose shape, down to the lips, everything we worked out and did the association as to whether or not that's a psoric feature, a syphilitic feature, or a psychotic feature, and so on. Because the bottom line is that I always kept Hahnemann's idea that if you're going to get a constitutional prescription, and that constitutional prescription is going to be deep, it has to be the sum total of the signs and symptoms plus the miasm of the patient, together with the matching miasm of the remedy. If you don't have that, you don't have a constitutional remedy.
You might get a result, but the depth of it and the longevity of it will not be the same. So we've just gone through the photos, and when either yourself or myself start a case, that's the first thing we look at, right? It's the first thing.
And if you get that wrong, you get the whole thing wrong. This is why it's so important.
Well, I shouldn't say the first in a way, because you can put a good argument for looking at the case first. And to be honest, when I teach students, I do say look at the case first. And the only reason I say look at the case first is you don't want to bias the miasm by kind of second guessing it from the case, and then you tend to bias the photos. But look, one or the other, you got to look at them first and really make that decision on what group that patient is in. Let me ask you, when you look at a case, and we have a case pro forma, and once it's filled out, the answers can run to about 10 pages of information. It's the top-to-toe approach with the generals, all the good questions. What's your main complaint? What are your modalities, etc.? What do you look for in a case? When you first look at a case, what stands out to you?
The main thing that I'm looking for is that I'm looking for any sort of modifying factors. That's the number one thing, right? So I'm looking, you've got
modalities essentially.
Essentially modalities, or anything that's a little more odd or less common in that illness. Like if you take a case of pandas, because I just am flooded with pandas cases, right? So if I look at a case and they say it was a sudden onset, they get quite aggressive when they're upset, they want to immerse themselves into the world of electronics and screens as a way of escaping. They have trouble getting to sleep at night. They're worse for sugar. They're both really needy and anxious, yet aggressive at the same time. They don't like being left alone. All of this, what they're saying is that, excuse me, this is what pandas is. Now, I already know that. That's the thing.
So it's common
so
presentation.
It's a common presentation, and essentially it's the pathology. Right? That's how that pathology presents itself. And if I'm going to quote Kent, and the quotation is from when he, in the introduction to his repertory, if you're going to start with pathology, you're going to fail.
You've got to see how the body is trying to fight back.
It's trying to fight back because you have two sets of signs and symptoms. Now, have we already gone through this?
We have spoken about it, but we're going to cross over lots of different things. That's the nature of just chatting about homeopathy, isn't it?
Well, yes, I guess it is. That's right. I mean, so you have two sets of signs and symptoms in every case. The first set of signs and symptoms are the symptoms of the pathology itself. Now, you've got to understand what the pathology is. Pathology is when your body is losing the fight. Right, so it's the illness is starting to take over. How you can have a constitutional problem like pandas, and then you sort of say, well, how is that all? How are all these behavioural things related to the pathology? It's because the brain is being inflamed in a very precise area, which is causing very similar problems in everybody that has it.
And so similar, they're getting the same label.
They're getting the same label.
Yep.
That's what that's all that a label is that it's saying, okay, I've seen this before. And so instead of going through all the symptoms, we'll just call it X disease, and that means that everybody whose role it is to try and alleviate that disease knows immediately what you're talking about by the one word summary.
It's just how we communicate something complex in a simple way.
Yeah. So a diagnosis is just exactly that. You're exactly right. It's just a diagnosis is how you can sum up a complexity of problems and tell somebody in the most briefest way possible, but in an understanding of the complexity of it with that one word or that one noun. And so with pandas, I understand a lot about what's going on. But those symptoms that I was just talking about, they're the signs that the body has not been able to deal with the inflammation. Right? So they're the outcome of the inflammation, essentially that your body's losing the fight. And the deeper that you're immersed into those symptoms, then the worse off you are. Now that makes sense. But there are also other ways that your body is trying to stabilise, and these are the symptoms that are uncharacteristic of it. These are symptoms where you might see a person whose whole demeanour is better if they put an ice pack on their head, or their whole demeanour might be better if they have one sleep in the afternoon, or their whole demeanour might be entirely better if they go for a run around the block. Now, I don't know, this is the problem, is that I don't know why the body chooses those sort of signs and symptoms as a way of healing itself, because you can't see the vital force at work. But a symptom that is uncommon is your body trying to re-establish balance.
What about the aggravations? Because I know you...
No, but if I can just finish this.
Keep going.
So why that's important is because when I do a repertorization, that is a summary of all what I consider to be the important signs and symptoms, I'm taking the ones that are less common, because now this is your body fighting back. Now, what I'm doing with the remedy is that I'm doubling up in the way... I'm choosing a remedy that has the same symptoms, meaning that it will have to have the same resonance as your body in trying to fight. I'm doubling up on the body's ability to try and fight back.
In its own unique way.
In its own unique way. And then where the miasm becomes important is because now this is the way that it's defending itself, right? So the signs and symptoms are how it's trying to defend itself, but then the miasm is the way that it's trying to defend itself. And by that, I mean, the yellow group, we don't do sore or psychosis, syphilis anymore. I'd never liked them, particularly for the modern world. They don't make sense. They're judgmental.
And they're disease names.
They're disease names, and they're just, well, look, they're just wrong.
So they're losing names.
The idea of this is a miasm gaining ground and making us worse every generation is just not true. Kent was one of the major ones that did that, and it's not true. He's wrong. And you're allowed to be wrong, by the way. Homeopaths have this idea that Hahnemann or Kent can't possibly be wrong, otherwise the whole house of cards comes down. But that's ridiculous. They did make mistakes, both of them. made mistakes. That doesn't mean, though, that doesn't denigrate when they're right.
Yeah, sure.
Okay? So just because you're wrong on one thing doesn't mean you're wrong on everything. We're a bit paranoid as a profession about that. What if we just take Sora, for example? Sora is trying to throw everything from to protect the vital inner core by throwing everything as far onto the periphery as what it possibly can be. Now, when you do the signs and symptoms, or what you call the personalised or healing or uncommon signs and symptoms, now what you're doing is that you're selecting a remedy that has the same energy that's going to help that person throw it to the circumference more and maintain a balance.
And what's interesting about the one you've chosen is, I think, from an almost a naturopathic and homeopathic point of view, there's almost this idea that that's the best way or the only way to protect yourself is to throw things to the surface.
No.
But the reality is there's 6 other ways, and they're all different, and they're all equally as positive in their outcome if they're working effectively. So you can actually draw everything to the centre as well as push everything out, and they're just 2 totally opposite ways of achieving a healthy outcome.
When you say draw everything to the centre, I think what you have to do is highlight that you're drawing the vital energy of the body into the centre. You're not drawing in the poisons and infections, right?
And that's a different way of looking at it, you're right. So throwing out to the surface is your energy's pushing out rather than literally every toxic thing sitting out there. However, nonetheless, there is more skin issues with that way of defending.
Well, there's a whole lot of issues with it. And this idea that it's more effective is just wrong. There are aspects, there's animal, through the whole animal kingdom, and not only that, through the plant kingdom, that will employ all of these. This is the other thing we have to understand. We're not on our own. This is a natural process. This is just, there's a Chinese thing called Li. It's just Li, just repeating patterns. Or, in the more modern day language, we call them sort of fractal patternings and things like that, where essentially it's just nature, of which we're a part of, is reproducing the same patterns not only in ourselves but everywhere if you go looking for it. And those patterns, and this is where HFA becomes really important, because those patterns are exhibiting themselves on every aspect of our body, including our face, and we've just worked out a way of being able to understand it. But those patterns are showing themselves everywhere. So if you sort of say, if the pushing to the circumference or pushing to the periphery was the most effective, then most plants and most animals would do exactly that. But that's not what we see. There is a collection of ways. I mean, it's winter time now in where we are. I'm looking outside, it's drizzling, it's cold. We've got deciduous trees. I mean, that's what that is, right? I mean, so you've got
conservation of energy.
This external stress, which is too much. So you can't, the tree itself can't maintain that kind of energy supply.
Like the vibrance of summer or spring or even autumn.
No, that's right. In spring, all energy is going up from the roots to the leaves. And now the leaves are trying to photosynthesize and get as much sugar into their system as what they possibly can. But come the autumn or the fall, if you're American, the autumn and winter, the exact opposite happens. All of that energy is now going from the top of the tree into the roots of the tree. So the energy is going down, not up. So there's no more growth period. But what it's doing is that it's conserving itself. It's conserving its energy, waiting for a better time. Unless you're going to turn around and say bears and trees and all this have somehow got it wrong. then we just have to accept that there is no hierarchy of how to do this better, so
it's just different ways. But what's interesting is the plant goes through phases. So it goes from the summer phase to the spring, to the winter, to the sorry, I've gone in the wrong order there. Summer, you know what I mean, the 4 seasons. Yeah. It moves through the different seasons. But the interesting thing about the human being is it has one dominant one of 7, not just 4 seasons, but 7 miasmatic defense mechanisms. We all have one of those. So we're all either, the summer, or we're in the spring or the autumn or the winter, and there's actually 7. So there's some crossovers in between. So the human being is slightly different to the plant kingdom in that way, in that it literally has a very specific and singularly dominant way of protecting itself and using its own defense mechanism. And it can be seen in the facial structure, it can be seen in the remedy. And when you match those two together, that's kind of step 1, photos, step 2, case, or case can be first, photos can be second. But those two are the beginning steps of starting to work out what remedy you're going to choose.
Yeah, they're the foundation. If you've got that wrong, you've got everything wrong. But when you're talking about the autumn, or you're talking about the summer or whatever, that's not the tree going through different aspects of protection. That's just a cycle, but it's dominantly still you will be able to look at tree structure, leaf structure, and you can work it out. We're just starting to do that now.
So what you're really saying is structure overrides performance, or behavior, so to speak, because the tree behaves in a different way through the different cycles.
Well, you can't separate structure and function, is what I'm saying.
Yeah, right. Okay.
I mean, the two go hand in hand. Your collarbone is designed the way it is because of the function that it performs. And we say that about absolutely everything, down to our toenails and our fingernails. And yet when it comes to our face, everyone jumps up in the air saying, no, that can't possibly be that. And yet it is. Of course it is. Yeah. And in fact, it's our most expressive part of our body, and yet we're not going to express anything of the force that's inside us. I don't think so.
Well, we definitely do. So getting back to the process, we've talked about photos, we've talked about the case and how important the modalities are. But I still will ask that question though, because even in my own mind, I don't think I could answer it if someone asked me. I know you put as much emphasis, possibly more, on the aggravations to the ameliorations. You could argue that an aggravation isn't really the body's best way of trying to get better, because in that moment it's getting worse, aggravation. So why is an aggravation important to the way the body is trying to defend itself?
Okay, so what you've got, though, when you're dealing with a constitutional, the 2 things. One is a restoration and the other is a replenishment. Okay, so it's trying to do 2 things. That's why you can use it to combat an illness, but at the same time make the person feel better as they go along. Mm-hmm. Now, when you're talking about the aggravations, you're talking about stress points within a person. Okay, so if you were dealing with any other kind of structure, as you know, but by the old saying that a chain is just as strong as its weakest link, what we're trying to do when you get these aggravations in the body,
they're the weak links.
They're the weak links, right? And so the sum total of those weak links can be addressed by a remedy that represents those sum totals, which will then build it up.
As well as the strong parts, which are the ameliorations.
Yeah. So what I say to people sometimes is that when you're on a constitutional, it's a bit like you've come to me and there's a big hole in the ground, and every time an infection or a new thing comes along, it's like your child or yourself is being pushed into that deep hole. But what we're doing with a constitutional remedy is that we're filling in, we're backfilling that hole. Now, that doesn't mean to say And this is really important for people to understand, because there are some practitioners out there that are going to suggest that on the right remedy you'll never fall back in the hole. And that's not true.
Enough stress and you'll fall back in the hole.
Life is life, man.
Yeah,
right?
sure.
Life is life, and, shit happens. And as a result of that, yes, you will fall back into that.
Just might be a few years away, or it might be a few months. You don't know when.
But the problem is this. I mean, look, no, the benefit of being on constitutional remedy is this. One, we've backfilled a lot of that hole. So if you do fall in, you don't fall as deep.
And you could argue with your analogy that your feet are on more stable ground,
and that
so
was
you can
point two.
tolerate the stress better.
That was going to be point two. Point two is that instead of just the slightest breath of wind and suddenly you're falling into that hole, now it takes an ever-increasing, because you're stronger, it's going to take an ever-increasing strength of the trigger that to push you back into that hole. That's what constitutional prescribing does. But make no mistake, you can be pushed into that hole. You definitely can.
Enough stress and anyone's going to cave.
Absolutely.
And I think that whole analogy is really good. And the word cave, it implies you are dropping down. You're going somewhere you don't really want to go, and you need a really strong helping hand to pull you out.
Yeah, but it's important to know that, because as you know, we've seen practitioners that will go, well, if they were on the right constitutional medicine, they shouldn't have got sick. Well, that's not true, mate. It's not.
And it's an unrealistic expectation.
Even if you do get sick, like let's just say there's a cold around and you do get it. Well, it's a bit like just general health. If you're on the right constitution, you should really be able to get through it. Your recovery time is quicker and it's more complete. That's what we're looking for. Not the fact that you got it at all. That's not the point. We live on a planet where we're all in this together. So, you're going to be on a train. You're going to be in a supermarket. You're going to be where people are coughing and sneezing and spluttering, and that's just life. And even if you do get it, that doesn't mean you're sick. It just means that you're a human being with an active immune system. But where sickness comes in is if you get some cold and you just can't shake it and you're 2 months down the track rather than 1 week or 10 days and you're back on your feet, well, then you're sick.
Yeah.
To get a cold and be back, in a few days, that's
very
pretty
good.
good.
It's very good, because the average cold is 7 to 10 days, no matter what the treatment. But we often see with good homeopathy, where someone's already, you've brought them up to a reasonable level, that, if they happen to fall back a bit, they can get over it in 2 to 3 days, which is great. I mean, that's such a bonus for us, and we shouldn't poo-hoo at that because it wasn't zero. I mean, it's still really, really good. Now, just in regard to these steps, we've covered photos, we've covered looking at the case. This is very, very basic, but just a reminder of what we do. You've spoken about the repping and choosing particular rubrics that represent particularly modalities or something intensely unusual or just very focused about the case. It can be a number of things. And I'll just remind people of our online courses that we really explain this in great detail. So if you want to learn it, it's actually not that hard to learn once you know what you're looking for. Then, of course, there's case management. And I know that case management is a huge topic. It's related to energy, it's related to environment, it's related to singular stresses, it's related to ongoing stresses. The word management is huge because you have to manage the reality of all those factors. Have you got any kind of, I know I don't want to really go deeply into it because it's a huge topic anyway, but have you just got any general advice for what you think is important about good case management?
We got, as a profession, this wrong for 100 years, I reckon.
That's a big statement.
We got this terribly wrong. And even with Vitulcus in the 70s, it's wrong. It's just
define what was wrong first.
Okay. Here's the thing, right? I remember going to a lecture by an Indian homeopath, and I was really impressed with the time because somebody asked, they would give a 200 or a 1M, or they'd do whatever, and people would be writing all this stuff down. And then I remember one person asking, and what about repeating the remedy? And they sort of, in this sort of puffed chest way, said, I never have to repeat a remedy. I've never repeated a remedy.
Seems unusual.
No, but at the time I thought, wow.
Of course.
If only I could be that good.
Sounds good.
Now I realise if only I could be that good a bullshit artist.
Oh, that's harsh, Grant.
No, well,
but
because
yeah, there is a truth in it.
No, listen.
Yep.
Here, we can't pussyfoot around this
Okay.
kind of stuff. Because the reality is that every day in my clinic, I see people in a really serious condition. Now, thankfully, not everyone's in a really serious condition, but I see people every day who are in a very serious condition, and we can't get this wrong. It's not, there's time, and this is why I get a little testy about it, okay? Because we shouldn't be really pushing forward and accepting information that's just clearly not right. And I've my clinic has found, first of all, what I did with HFA was a rebuilding of homeopathy from start to finish, because what wasn't working had to be dropped.
But you wanted to keep what was working.
But what was working, I remained. And I could see and I tried everything, multiple doses, LM potencies, centesimal doses, not repeating, daily repetition, weekly repetition, monthly repetition. I did all of this kind of stuff, and then started collating in my own mind what was working repeatedly and what was not. And then once I started seeing that there were definite patterns, I was not loyal to the philosophy of homeopathy. Homeopathy,
you were loyal to the good outcomes.
I developed a philosophy around what worked.
Yeah.
That's it.
And that's good case management.
Yeah. Now, case management's really, really important. And when I say that we've got this wrong for a long time, and even down to, currently with Vitulcas back in the 70s, and this has gone, and this is not blaming him. I'm not having a shot at him as such, but what I'm saying is because he's just continuing what already existed, but
is it the best that you can do?
It's so far from being the best that you can do. So far. And the reason is this. A remedy is just an energy. And one of the problems that we're finding in the modern world, we're trying to get wind power up, we're trying to get solar up, and we realise that the wind doesn't always blow and the sun doesn't always shine. And the biggest problem with that is, how do you store energy? Well, you don't. And you certainly don't in a mobile and active battery like the human body. The human body is using energy. It doesn't store it very efficiently.
A little bit, but not much.
Not really. And if you store too much, then it breaks down. You can't use it at all. So in the end, you need a constant supply of energy.
Eating, sleeping.
Happiness is another one where you get a lot of energy. So where I'm saying we got it wrong for 100 years is in that one area of
the dosing,
giving the dose and then not repeating.
Yep.
Now, I've seen patients that have come through and said, I've seen homeopath X, and they gave this remedy and it didn't work. Let me put it another way. It did work and it did wonderful things, but then it stopped. And so then I'll ask, was that remedy repeated? No, they went on to something else. And that's the mistake I'm talking about. Doesn't mean that person was actually off the mark. In fact, as a practitioner selecting a remedy, they were spot on. They are a good practitioner. But what they haven't done is that they haven't taken into account that the human body it needs continuous replenishment by energy.
Until it builds and builds and builds, and then it can get by just on the sleep and the food and the happiness. But until that
can be a while, because
sure.
Here's the other thing we need to take into account when we're dealing with remedies, is that it's no longer about maintenance. By the time you become a patient, you've got a problem. You've generally got an organic problem going on here. Now, it takes more energy to solve that problem than it does to maintain it once it's solved. You've got to get to that solved point.
Step 1 is fill in the hole, and step 2 is try to keep it so you don't create another hole.
Yeah. So you can't be really strong until that hole is filled in, so to speak.
Yeah.
No. So, but you can't. It's like food. We need to eat more consistently throughout the day, just to maintain our energy levels, or we need to sleep every day. We can't just say, I'll tell you what I'll do, I'll get 10 hours of sleep, or I'll get 12 hours of sleep, and that should be enough to last me a few days. It just doesn't work like that. And neither does remedies. When you're talking about energy, it just doesn't work in that material way where you can just build up a surplus and think that you're going to be okay. Yeah, it's all about the consistency of the remedy. And so when I say homeopaths have got it wrong for 100 years, and even a lot of modern homeopaths getting it wrong, that sounds on the surface like I'm saying, oh no, they're no good as a practitioner. That's not what I'm saying. In fact, like I've just said, many of them are very good and they've got the remedy right. But then they undo it by sticking to the philosophy that we should give one dose and wait, which was a Kentian philosophy that was really dominant. So when I bring in, say, someone like Vitulcas was also saying that back in the 70s, 80s and 90s. I don't know whether he's still saying that kind of stuff now. So if he isn't, that's great. But if he is, he's off the mark.
Even Hahnemann started the LMs in the latter years before he passed, and that was all about repeating the remedy.
He knew you had to repeat.
Yeah,
he really knew you had to repeat. But the problem is that he lived in a time where the medical profession were going to go in him at the slightest breadth of wind different. If he made a mistake, he knew that they were going to go in. Now, partly that's his fault, because just like Paracelsus, he was going everybody that disagreed with him. He went at them with venom and vitriol. And that they just started seeing him as this really sort of arrogant cuss. And like a lot of people that are, really arrogant and boastful, you want to tear them down. That's what people want to do. And they're waiting for him to make a mistake.
So say it out loud. What was the error he made?
The error that he made was that he did say that the one dose of a 30C, but the 30C can mean one dose of anything. Any remedy, and 200, 1M, it doesn't really matter. But the one dose of a remedy will be enough to fill that whatever is. So that 30C, that one dose will do all a 30C can. And if it doesn't work, then we either need to change remedies or we need to go up. And that's where he was wrong.
And he was wrong. And yet probably you and myself have very occasionally, like, I don't know, 1 in 1,000 perhaps or something like that, heard the story where someone took a single remedy and X was better ever since. But, is that the totality? Generally not. It was the one thing they had at that point in time and it kind of never came back. Well, good on them, but 1 in 1,000 is nowhere near enough to work with.
You can't build a clinic on 1 in 1,000.
No.
You can't build a clinic on one miracle and then keep claiming that one miracle.
No, it's great. It's a miracle. Fantastic. But we were looking for consistency. And the thing with case management that I've seen you really develop in the last decade, from a simple idea of energy replenishment to really testing different potencies, different frequencies, sticking with the same remedy when it may have only done 30%, but going, well, if it's done 30%, let's try it at a different frequency to keep it going.
Well, this is really important. Actually, now you're on to something that's vital. So you've got to, again, you have to take the model, right? Essentially, when you're talking about constitutional, meaning there's a multitude of problems all happening at once. So if we're taking an adult here, an adult who gets migraines, who has arthritic problems, they've got digestive problems, they don't sleep properly. So their constitution is out. Now, what has generally happened is that there is a misappropriation of energy. And that misappropriation of energy has gone from daily maintenance and enjoyment of life into generally something like an anxiety or an anger or a fear or whatever, or just having to care for somebody who else is sick and they're being drained down, and so their life force goes down with them. Or it could just be simple overwork, even though what you're doing you want to do, but you're overdoing it. So you're expending more energy than what you actually have on a day-to-day basis, which is fine when you're younger because you can draw on tomorrow's energy and use it today. But eventually, when tomorrow comes, you've got nothing left. Now, any area of your body that needs maximum 100% input of daily energy to keep it in a good spot starts getting denied that 100%. And so now pathology starts to begin. It's first it can just be more functional pathology, aches and pains, stomach upsets, things like that. But as that 90% starts becoming 80% and starts becoming 70%, now you start getting pathology beginning. Now, here's the real problem, is that pathology not only interrupts the energetic flow process, but it also is creating a threshold of pain that is now burning up more energy. So that starts becoming like a snowball down the hill. So instead of losing 5% here, 10% there, just feeling a little queasy, little off colour, and then you start hitting that sort of 70, 80%, but then the next drop, suddenly it's 50. Or it's 40. You've only got 40% of what you used to have.
And you're pedaling backwards.
And now you're in trouble. Now you're in serious trouble. You're taking painkillers. They can't find the right diagnosis, or they can, but it's not helping anyway. Now you go into this whole sort of pain-killing, masking sort of stuff, but you as a constitutional you keeps going downhill. Now that's usually when we see people. But
so it takes a little while to start rebuilding.
When you understand that energetic model, when you say that, okay, well, we're taking one step forward, one step, you can see that they now no longer have the life force to create huge leaps forward. So what we've got to do is constantly supply them with extra remedy, and they can't miss it. I've got people that will go, if I miss a day, I notice it. All the pains start coming back.
And that's not palliation or suppression, that's rebuilding. And so if you see a case that, particularly one that's in pretty bad shape when it starts out, and possibly an older person as well, 30% improvement after 4 weeks on a remedy is a very nice start. If you can get another 30% in the next 4 weeks and then another 30%, statistically, it's possible over a 3-month period they could be in a much, much better place. But the practitioner must observe case management. And it can fluctuate up and down like an investment portfolio where you're watching the graph. It's going in a good direction forwards, but it slips backwards and forwards every now and again. And this is where case management is hugely important. Like you said, a lot of practitioners do get the first remedy, but then for whatever reason they lose confidence, they move away from it, and they may never go back there. If they're not using case management, what we call, this HFA, energy rebuilding first, then maintenance. Then you can test. Some patients never want to leave the remedy. They're so happy with it. It's actually not a problem to stay on it as long as it's forming good maintenance for them.
The body will let you know
when it's too much. And then like in that LM principles, a little bit too much, now you stop.
Yeah.
But it's really important, and we focus on this in the courses, and I'm going to go back to this because we really want more practitioners to start learning this HFA process, to really get to a comfortable level with understanding what a miasm is and how important it is for every case to have that foundation to work with. And then, it's really, repping can be super straightforward once you know what you're looking for and your form or your interview with your patient is pulling that information toward you. Then knowing how to assess what first remedy to choose, how to give it, but then the case management. That's where the gold is. That's where you've got the good start. Now you've got to keep it going.
It's where the individuality is. You see that when you're talking about the photos and you're talking about the repping of the case. Now, this is, again, where I'm going to deviate from conventional homeopathic wisdom, because when I was taught and when you were taught, really everything came down to remedy selection. That was where the individualization process or the individuation process really took place. It was hammered into us. The difference between one remedy and another. And some of those differences were pretty darn micro, I'll tell you that. Well, what I'm here to say is that's not right. That's actually not right. The individualization process really takes place. The skill of this is in the case management. You see, the face and the repertorization just tell you what energy that patient needs.
Where to look across 4, 5 or 6
how
remedies.
they need it, that's case management.
And
right?
that's individualisation.
And that is individualised. And you need to you need to understand these things about the individualised process in case management, because, like you were saying, people will still fall down. Now, you were talking about palliation before. It's not palliative, right? So I'll tell you how you prove that it's not palliative, because I will get people that will say, I went away for the weekend, or I went away for a week and I forgot to take my remedy, and by the end of the week, I really slipped back. So my next question is, and this becomes really important, did you slip back to square one? Were you as bad when you weren't taking it? By the time you got back to your holiday, when you say you slipped back, was it to the same degree as when you were originally filling in that performer? No, that's not what I mean. What I mean is that I was nowhere near as good as when I was taking the remedy. So, all right, let's just say, for convenience purposes, that when you wrote out the performer, all of those symptoms were 10 out of 10 in their severity. 0 means you have no symptoms at all. When you came back from that week, where would you have said that you slipped back to? 60, 70%? Okay. Now what we're going to do is we're going to go back to our hole in the ground scenario, because we've filled that in 30 to 40% now, right? So we're showing, because palliation means that if I'm giving you a remedy and you're better on that remedy, when I take you off that remedy or you forget it, you not only go back to square one, you go worse. Worse. Now, that's important to understand, because a palliation means that you've done nothing to quell the advancement of that pathology.
Yeah, makes sense.
So in the time that you've been taking that remedy, that pathology has continued to advance. So the moment that you go off that remedy, you will actually feel worse than what you used to. Mm-hmm. But that's not what people say. Not really. Not when they're on a good constitution. They'll say they did slip back, but I'll give them 50%. Well, that's still 50% improvement. But all that's telling me is that your vital force or your healing mechanism, for whatever reason, is just slower.
And it still has 50% to go.
And still has 50%
but you can bring
to go.
Bring it right back up, and so now they're 2 out of 10 instead of 10 out of 10 or 7 or 6 or whatever. You can get them to 2 quite quickly again, and then it could be a little while from the 2 to go to the 1 to the 0.
And also though, Louise, is that considering their age, their lifestyle, their diet, their stress levels, their work levels,
2 can be excellent.
being 50. They might only ever be able to get 70% of improvement. And if we've made 50% improvement, that means that we're only 20% off their best that they're possibly able to be, considering their lifestyle.
And then, of course, you start talking to them. And this is the sort of the 6th point is, how much as a patient are you willing to adjust your lifestyle? And you make suggestions to people, and some of them are just not interested, and that's their call. That is their call. You would think you'd want to test a few things, because if you can get that last bit with just a few changes, why not? But for some people, that change is not palatable for them. They don't really want to go there. No. That's up to them. But you can always say, you're very good at doing this, assessing their lifestyle. That's your naturopathic background and your, psychotherapy background as well. You can often point out areas where they can do even more. I mean, there's always room for improvement.
Yeah, but that doesn't mean they want to do it.
They might not want to, but if they do, for those that even take it further, the outcomes are really quite strong. They're pretty incredible. Can I just kind of wrap that up for you? I know that, we've been going nearly an hour, and that's a nice sort of time. I had a really good another topic, but it's way too big to add on now. So
just though, before you get to that, you see why, though, that with just small scenarios like that, we have to take lifestyle into account. We have to take the psychology of the person into account. We have to take their work-life balance into account. How much sleep are they getting? What is their recuperative power like? Where are they in their social status in life? What are their relationships like? That is the individualization process. And that is all what's being taken into account when you look at people when you're doing the posology, which is just the dose, right? Case management. And so that's why I say that that's where the individualization process is.
And those last topics that you've just listed, that lifestyle interaction, it's really fascinating, and we will go further into that. We want to talk about life themes. There's so many really interesting energetic areas to explore. And the thing I'm going to end on is what I would like you just to allude to, but I'd love to do in the next podcast. We had a discussion very recently, yesterday I think it was, where you don't talk a lot about what you do in clinic because you're very busy and you like to switch off. But you did mention that some patient during the week had asked you a really good question about, and I think it was along the lines of, what do patients most commonly do wrong, or something like that. Was that the question? You recap that question, because I don't want you to. I don't want you to answer it now, but I would like you to remember what that question is, and then we might talk about that next time.
Crumbs!
It was something about it was a good question. They were really thinking it through. What do you see clinically? It was along the lines of,
No, it was. What do you... Oh, gee, I'm really paraphrasing.
That's
now
okay.
Because I can't really remember it. But it was, what What do you see that the average, and they're talking about adults here.
Yep. Mm-hmm.
What do you see is the biggest mistake that the average adult patient makes in their life?
Yep. Yeah, and it's a really good question, and you paused and you gave an answer, and I'm going to ask that we start the next podcast with that question, and that you explore the answer that came to you based on your 30 years of talking to people about all the things that go right and wrong in their lifestyle. You did have a point of view that I thought was really interesting, so worth talking about.
Okay. Well, you'll need to remind me next time.
I will.
Because I will absolutely
I
forget.
know you will. That's perfectly fine. I'm taking notes. Thanks, Grant. It was really good.
All right. Well, thank you, everybody, for listening. Thank you, Louise, once again for all the questions. And is there anything else we need to add?
I think that's more than enough.
Okay. All right. Bye-bye and see you next time.
Thanks, Grant. Thanks for listening to Soul and Survival. If you are interested in more information, books, courses, consultations, learning more about facial analysis or life themes, please visit our college site, Victorian College of Classical Homeopathy, vcch.org.